So the ROSA device, or the robot that we currently use at Humber Hospital, is not unique to Humber. Since the implementation of ROSA, there have been acquisitions of other hospitals of the same robotic technology. Humber River was the first in Canada to introduce this robot for surgical knee replacement for widespread use almost 3.5 years ago. So we were definitely the first, and since then we've taught various institutions and other surgeons how to use the same robot, and several of them have been placed across Canada. But if we look overall, there's probably less than a dozen surgical robots across the nation. And what's nice is that we have 2 of them living right here at Humber Hospital. The surgical advances that we've had because of ROSA has definitely changed the way that we do knee replacements. So in discussions with my colleagues, Dr. Barry Kane, Dr. Justin Chang, and Dr. Martin Heller, who were the early adopters of robotic technology along with myself, the way we think about when we do knee replacements has really changed a lot. Traditionally, we used to do knee replacements very much formulaically. Everyone got a cut at a certain degree. Everyone got sort of standardized sort of approach to knee replacement. What ROSA has allowed us to do is to personalize their knee replacement in terms of sizing, in terms of evaluation during surgery. And because of that, we've changed the way we do surgery. We now can plan their surgery ahead of time and edit the way we will place things within the body because the robot is so accurate, and then do the procedure. Whereas traditional knee replacement, actually, usually you do the cuts or the procedure ahead of time, and then you balance or try to make it as good as possible after. So if we look at it and how we teach people, be it residents and fellows now, we're actually doing the opposite now. We're now planning more and performing a personalized surgery as opposed to doing sort of a prescriptive surgery and then trying to tailor to that person after we've made all the bony cuts. So it doesn't seem like much, and when you look at x-rays, they don't look vastly different, but it's actually completely flipped the way we do knee replacements. So I think a lot of patients initially were actually worried when we said we had a robot that'd be doing surgery. Many of my patients told me specifically, I want you to do the surgery, not the robot. And there's sort of a misconception that there's, a robot like we see on movies that's in the room and is just doing all the surgery, and the surgeon's in some other room just pushing a button. The robot is really a robotic arm, and the definition of robot is anything that a machine that assists you to do work. And so this robotic arm allows us to do a few things. One, it allows us to do more accurate cuts at different degrees and angles that the human eye and manual instruments can't do. So that's part of the robot. And then the second part of the robot is because we've placed trackers in the leg, we can now measure and evaluate the leg as we've done surgery. So we can see where something is tight, where something is loose, how something is aligned, very much to the millimeter and to the degree, which again, with traditional instruments, we could not do. So the robot has added a lot to us. And in terms of patients and what they get out of that, patients, if they looked at their x-ray, again, wouldn't know the difference if they've had a robot or not had a robot. It's not done with a laser or through a keyhole incision. It's not magical. But the way we think about doing knee replacement and what has changed and the alignment philosophies it has taught us has shown that those patients do better earlier on. We've noticed from an administration perspective, they told us that these people were using less physiotherapy resources. They needed less follow-up. They were able to be discharged from clinic sooner. Their knees felt more natural. So we're in the midst of compiling that data now to formalize it for publication. But what we've been able to show is that robot patients in general do better than non-robotic patients. And that's because we're able to, at the time of surgery, dissect less. It's still a big incision, but some of the actual dissection we do around the knee traditionally has been minimized. And so now people are reaping the benefits by being able to recover faster. I guess no, but when I think about it, we've been doing robotic knee surgery now, as I said, for several years. And I commend the administration and the hospital because we really brought the robot in during the first wave of COVID. That was something, a passion of mine, that I really wanted to bring in robotic technology to Humber Hospital, specifically for hip and knee replacements. And it was a long road to get there. And unfortunately, COVID hit right as we were in the midst of trying to finalize those plans. After the first wave and the massive shutdowns that we had, we were able to secure a surgical robot and able to start that program just 6 months later. And as you know, and everyone knows, unfortunately, since then, we've had 2 other further surgical shutdowns. So a lot of the time we were just starting on a project and then we sort of lost that momentum. And we lost surgical time, and patients have been waiting longer for their surgeries than they have for several years. So I mean, it's been 3.5 years, but it feels sometimes like much longer when you think about how long it's taken to get to where we are. But with the group of surgeons that we have now, with Dr. Chang joining us, we've been able to greatly increase our surgical volumes robotically, to the point where now we've had a second ROSA robot acquired by the hospital. And the rest of my colleagues have all started to adopt robotic knee replacement surgery as well. So now we can say almost all the knees here at Humber Hospital will be using the same technology, which is a first in Canada, and we're very proud of that. That's a great question. I mean, when we first got the robot, we knew it was very accurate and we knew what it could evaluate intraoperatively. But like I mentioned before, the robot has really taught us how much we didn't know about knee replacement surgery. I mean, that's one of the things I tell people when I teach people, is that the way we do it now is totally different when we started off with. We used it as a very accurate measuring and cutting device to start. And now what we know about using the robot is how we can use that precision to be able to guide surgery for patients has allowed us to completely change the way we think about knee replacement and to customize every patient's knee replacement in a way that is not achievable without the robot. And it has totally changed our mentality of how we do and approach knee replacement. And it's subtle changes, but in terms of the planning and then the outcome of those knee replacements, it has flipped the way we do it. So I think it's been a huge benefit to us in terms of how we think about these problems, how we think about people's surgery, and how patients are now going to experience it. I think Humber has really been at the surgical forefront for that. If we look at our general surgery colleagues historically and their adoption of MIS technologies, and my urology colleagues were the first community hospital to have a Da Vinci surgical robot. Historically, Humber has always been able to push the boundaries surgically. I've been here for almost 10 years myself now, and I'm very passionate about technology and its uses to help patients as we move forward surgically. And Humber has been very enabling for me to do that. We were one of the first programs in the city to adopt anterior hip replacement. We're the first people to send them home the same day. We're now the first hospital to have navigation technology for every patient that has an anterior hip replacement, so we can measure their cups and leg lengths within degrees and millimeters. That technology has allowed us to do better quality of surgery as we've progressed with the hip program. On the knee side, as mentioned, we were the first to adopt the ROSA robot here in Canada, and in fact we're a teaching center for both those surgical techniques and technology across the province and the nation, in fact. And so I'm passionate about being able to use technology as we make surgery better, more streamlined, and overall improve that patient journey. What's next, I think, is that as we start to integrate other technologies like augmented reality, virtual reality training modules, as we have, hopefully can develop a surgical skills lab here at Humber Hospital where we can teach people both on cadavers in the operating room and sort of virtually in a simulation lab. I think as we progress that teaching, I think more and more people will adopt the same technologies, and hopefully Humber can still be at that forefront for the next decade.